Pleasant good afternoon to all. Let me first introduce myself, for those of you who might not be familiar with me. My name is Cuthbert Knights, and I am the Permanent Secretary in the Ministry of Health, Wellness and the Environment. You're all aware by now that we are battling with an outbreak of dengue, and the Ministry saw it fit to come to you to make a response on this matter. We have been responding to dengue not only in 2020, but whenever there's an outbreak in this country, we have responded very well. We have also been responding to this most recent outbreak. We, however, want to detail to you today our comprehensive response plan. As I said, this is not something which is sudden. The Ministry has been responding. We have the plan, and we wish to bring this to you. And we want to give our Minister of Health, Honorable Minister Luke Brown, to do so for us, to detail this plan for you. And he will give you the specifics. The plan comprises of several components, and he will detail these for you. Today with us also, we do have our Chief Medical Officer, Dr. Simon Kizabich. We have our Chief Environmental Health Officer and other officials within the Ministry of Health, Wellness and the Environment. After the Minister's presentation to you, of course, I'm sure that you, the members of the press, will have questions, and we do have appropriate persons among us who can respond to your questions. Again, I wish to really thank you. Before I call on the Minister of Health, just a few housekeeping matters. As you see, we are the Ministry of Health, and we are also practicing. We are we are still within the context of COVID, and we are still practicing our protocols. We do have face masks here for those of you who may wish to have them. We are properly physically distancing here. We also have our hand sanitizers in the room here on the wall. We have one on the outside in case you want to sanitize your hand. If you think that you need some towel to clean your desk or to wipe your hands, we also have this here. Okay? So again, I wish to thank you very much, and at this point in time, I will ask our Minister, Honorable Minister Luke Brown. He has been working very hard. He has been responding very well, not only to dengue, but also to COVID-19 before, and you see what an apt and adequate response he was able to lead us through, along with our Chief Medical Officer. I also want to say to you that our Honorable Minister has very much been in touch with what is happening. He has been grounded with his ministry, and he has been providing the leadership which we require. Again, his presence here is a very clear demonstration of that. And when he details this plan to you, then you will have further evidence of that. So I'm going to ask our Minister to come and to make this presentation to us.
Thank you, PS, for the introduction, and I'd like to extend greetings and a welcome to the Ministry of Health, Wellness and the Environment once more, to the members of the media who are here to cover this event. And it seems as if this is a familiar place to you. Perhaps sometimes we might change the venue, sometimes we use this facility, sometimes we use the Foreign Affairs, the conference room in the Ministry of Foreign Affairs, or we may use other facilities at our disposal. But the objective is always the same: to engage you and to provide information that on our response to various challenges as they arise, and any other information that may be necessary and appropriate. We are here on another occasion, and when you know, especially in light of the weather that we've been experiencing over the past few days, it might be apt for us to say, when it rains, it pours. And that is not only true of the climatic conditions, it's also true in respect of what we have had to confront as a country and even as a world by way of health challenges over the past few months. you would know that early this year we had to deal with the coronavirus pandemic, which was an event that is unlike anything that we have experienced in our lifetime from a health standpoint. And while we were moving through, and we're still pushing through that pandemic and doing what is required for us to have a strong response, we are now confronted with an outbreak of dengue fever in St. Vincent and the Grenadines. So the ministry has been in the midst of an intense period of work, and our ability to get through these challenges, our ability to overcome all that confronts us in this period has to do with the fact that we have a strong team, we have a committed team, we have a purpose-driven team that looks and tries to find solutions for the myriad of problems that face us. Now, we are here specifically to share information on our response to dengue fever in St. Vincent and the Grenadines. Now, this is an ongoing response. I think it is necessary to make that abundantly clear. And this is not something that is going to build on no foundation at all. We already have a foundation firmly in place. We have already been carrying out activities, and I'm sure that you have seen and observed some of these activities. And we are now going to amalgamate our efforts from this point onward and going into the future. We are at the beginning of the month of October. We're going to amalgamate our efforts under a comprehensive response plan, and it is a comprehensive response plan which was approved by the Cabinet of St. Vincent and the Grenadines at a sitting just yesterday. But by way of background, just permit me to say that I have great admiration for the heroic work which is being done by the Insect Vector Control Unit right now in an effort to drive down mosquito indices. I was able to walk a day in their shoes not so long ago, and I could tell you that they're doing massive work for the protection of health in this country in very difficult conditions. In very difficult conditions. When you have that first-hand experience, you have a greater sense of what is required to do the job of these insect vector control workers as they carry out their duties in a fogging operation. Now, you will know that with respect to dengue fever, there is not only an outbreak in this country, but there is an outbreak in several other countries of the Caribbean. So I don't want there to be any idea that St. Vincent and the Grenadines is unique in this position. And information on those outbreaks is freely available, and I think that it is necessary for you to maybe check out those sources for comparison purposes. But we focus our attention on what is going on in St. Vincent and the Grenadines. Information on the trajectory of the outbreak is provided on a periodic basis by updates from the Ministry of Health, Wellness and the Environment. And we pause at this moment to express the fact that our thoughts and prayers are with all persons who have been affected by dengue fever. I know from my own experience with the disease some years ago in a different country that it is a difficult thing for you to have to deal with. And not only do we have great work being done by vector control officers, we have great work being done by our health professionals, nurses, doctors at the Accident and Emergency Department, who but for their firm resolve and commitment could have been easily overwhelmed by the influx of patients and the greater demand for their services at that facility. I thank them for all the work that they are doing to keep this country safe. I heard reference to the fact that right now at the Milton Cater Memorial Hospital, perhaps 3/4 of all admissions are related to dengue fever. That is a statistic which gives us an idea of what is happening at our healthcare facilities. And we have responded to that element of the developments by, of course, expanding the availability of services through longer opening hours, and also by responding to to the need for health professionals to be available by providing more doctors and nurses. I think that they've already been appointed and have already been taken into the service of the ministry and are therefore making a difference in that respect. It has not been necessary to date for us to make use of the isolation center at Argyle, which is a facility that we built for our response to COVID-19 and which we are prepared to use if necessary, and we look at how the situation unfolds to deal with any need for spaces for individuals affected by dengue fever. But apart from that, we've already expanded the number of beds which are at the Milton Cato Memorial Hospital, and we'll take more strategic action from a medical care standpoint. Now, in addition to that, as I indicated here, we just convened this special assembly of media houses to talk specifically to a project which was approved by Cabinet yesterday, a project meant to take us from this point, October 1st, well, yesterday being October 1st, this point in the beginning of October, all the way into January 2021. Naturally, with these things, some of the movements in the cycle and how the disease is transmitted is not so predictable, so we always keep our response under review so that we are nimble enough to address those particularities. What we have here is essentially an integrated vector control program under a project that has 3 components. The entire or the overall cost for this particular project is $1.6 million, just over $1.6 million. So the government is serious and it's also putting its money where its mouth is in respect of doing something by way of strong response. So this integrated vector control program has 3 components: nationwide fogging and surveillance at all major ports of entry, and we expect that to ramp up our fogging throughout this country. We will need, and resources have in fact been provided to this extent, just under $1 million. Now, you might want to get a sense of what would this money be spent on. It will be spent on, for instance, the procurement of additional fogging machines and related supplies. It will be spent as well to bring into our possession, on whatever terms available, be it rental or otherwise, a sufficient number of appropriate vehicles which could be deployed into the field. It would also be used for us to take on board in a phased way an additional group of temporary spraymen, and it will also address some other costs associated with this project, including the cost of having a mounted truck fogger. Right now we use handheld fogging machines which are mounted or used on pickups and which are able to be deployed into the field through persons on foot. But we're also looking at investing in some mounted truck foggers for this part of the project. And so these pre-men will be essentially playing the role, and there's some other aspect of this to come out in another component of the project of vector assistance. Because we want this message to sink in far and wide. It's important for everybody to do their part to bring this outbreak under control. The ministry will certainly do its part, but in addition to asking what the ministry and what all the various facets of the ministry will do, it's good to ask, what can I do? How can I help? What is my role and responsibility in response to this outbreak? How am I going to be there for my nation, or even simply for my household? You don't have to think about it in grand and glorious terms. How am I going to be there for my household and my community as we deal with this? And I don't have any doubt whatsoever that we are going to deal with it, and that we're going to deal with it decisively and deal with it well, because it is in our nature, and our nature is reflected in the lines of our national anthem, whatever our future brings, our faith will see us through, and our faith will see us through this. You know, and we hope to get through it with as minimal a number of persons being affected as possible. So this $1 million component of the project has to do with expanded fogging, and it's going to build on what we have right now. You know, we have currently 2 fogging teams that go out from time to time. You see the schedule as it is published. It's important to pay attention to that schedule. So we have 2 fogging teams right now on 2 pickups comprising 4 persons in all. And we hope to take that over a period of time all the way up to as many as 24 fogging teams operating throughout St. Vincent and the Grenadines. So the situation what we have right now for the entire country, we are hoping, in terms of the number of teams, we are hoping to put that on a district level. For this purpose, the Environmental Health Division has divided, for administrative reasons, the country into 12 districts, and there will be the deployment of these teams in these 12 districts. Apart from that, there is another very vital, so we're ramping up fogging, and in addition to that, there's some ancillary activities, because there will be the application of larvicide to containers which cannot be overturned or eliminated, because it's necessary for us to look at that feature, that element of it as well. And there will be greater surveillance at ports of entry, and generally speaking throughout the country. So we're looking at the elimination of adult mosquitoes from the communities. But we also have to do something, and to me this is perhaps even a more important element of the project. We have to do something about the breeding of mosquitoes in the first place. You know, because we could essentially nip this problem, nip this matter in the bud, and that would make life a lot easier for us at the back end. So in order to do something about the breeding of mosquitoes, we have a project for the cleaning and clearing of rivers, streams, drainage systems, and the general eradication or elimination of mosquito breeding sites. Again, I want to make the point that this is not a situation where we are building from ground zero. Because just this past week, and I had a conversation with the Chief Executive Officer of BRAGSA just moments before coming into this room. Just this past week, BRAGSA, as an important civic responsibility, in execution of what it considers to be a sense of its civic duty, has helped with the clearance of several areas, several waterways, including waterways in Bottom Tongue, waterways in Calaqua, waterways in Bellevue, and this naturally has to be ongoing work. But the work is happening, and we're going to do it in a systematic way in the upcoming period at sites that will be identified by the environmental health officers and with persons who make themselves available for the execution of this work. You know, one of the things which has been happening is the way in which we see many volunteer groups and associations come forward and say, and put their hands up and say, I want to see what I could do to help. You know, and we're going to do this work for the cleaning and clearance and so on with volunteer organizations and with persons who are specially recruited for this purpose through the Public Health Department, and they will carry out activities throughout our country. And you know, we will be guided by the science. We'll take an evidence-based approach. We know the districts which have been disproportionately affected for whatever reason, and we have to get to the bottom of that. And we'll put resources in the pipe to be able to get to the bottom of that. And just to mention that logistical and material support will be provided by agencies of government as required. And I think that a meeting was convened just earlier this week under the by the permanent secretary in the ministry for the purpose of coordinating that cross-ministry platform for the execution of this project. So we looked at a $1 million component of the project. We are looking at here now at a $400,000 component of the project when you consider all that may be involved and all that may be required. And then there's another part of it which deals with risk communications and health promotions. And under this wing, we are hoping to achieve the production and distribution of health education materials on dengue fever and mosquito breeding sites. You know the different types of documents that could be produced within this ambit. You have booklets, posters, brochures, pamphlets, and other documents. We are also hoping to work on audio and video material with risk communication messages, and even to engage or look at the possibility of using electronic billboards. In other words, using every particular possible reference to get the message out there. Very importantly, we will have here vector control assistants, persons who are taken on for particular periods, especially under this project, that will work with current vector control officers to do several different things, including distribute some of the material that would be produced and carry out house-to-house inspections, home inspections, and to perform other tasks as they may be assigned through the appropriate channels. So we have a budget then for that component of the project, the financial implications for vector control assistance, health education materials, risk communication videos, and general public relations. I think that this amounts to a substantive response by the government that treats this matter with the seriousness that it deserves, and which continues on the work that we have been doing since we noticed an uptick in the cases in St. Vincent and the Grenadines to keep this under control. I'd like to leave my introductory remarks there. Thank you very much.
Thank you very much, Minister. And I just want to echo some of what the Minister would have said. You can see the response of the state is quite formidable. $1.6 million. And this is a very huge sum of money. And it is also a very strong response to this outbreak in dengue fever. And I wish to repeat again that this is building on the efforts. This is building and even enhancing what we have been doing in a response to this outbreak. I want to assure you that we are very confident in what we do. And we know the same way that we battled COVID, the novel coronavirus, and we're still doing that. As I said to you, we have responded to dengue already. And I know, and I'm very confident that we will get through this. We are a people, we are resilient. And this is not the first case of dengue we are responding to. I want to assure the public, and as the Minister have done, that we by no means are daunted. We by no means are dissuaded. We remain very resolute and we remain very confident. I also want to repeat what the Minister has said. We also call on you as a national of this country, and as we always said to you, our health, this nation's health, is a shared responsibility. Although we stand resolute, although we stand strong, we have to do this together. And dengue also requires your assistance. It requires you to play your part, as the Minister has said. You have to keep your surroundings clean. Get rid of all those unwanted containers, etc., etc. So you have your part to play. We are here, and we will, at this point in time, invite responses, questions from you, the members of the media. I want to say to you again, we have in our midst our Chief Medical Officer, and I know by now you're quite familiar with her, the outstanding work that she has done, the outstanding leadership she has provided to this date. We also have our Chief Environmental Health Officer. He also has been outstanding in his response thus far. And we also do have with us our Minister, who has provided for us very sound leadership and continue to do so. So at this time, I will invite any questions from you, the members of the meeting. And you will just introduce yourself for us as you ask your questions.
Like Compton Searchlight newspaper. In the last press conference that was held, you all, well, Mr. James noted that PAHO warned, I think it was Mr. James. Anyway, PAHO warned of a impending outbreak of dengue. Why does the ministry's response now seem more of a reaction than a proaction?
Okay. So we have the minister who will respond to your question. Thank you very much, Lieutenant Compton.
Thank you for the question. I'm not sure that the ministry's response should be characterized as a reaction more as opposed to being proactive about it. I mean, the truth is we have been doing work in this regard for some time. We have been doing work since July in a particular way, and we have been more or less preparing. But you see, the projection is one thing, but you could only calibrate the specifics of your response on the basis of the actual developments. And you know, the actual developments will guide us in terms of how many additional teams that we might need. You know, we use the experience with previous outbreaks from dengue fever and also with outbreaks from chikungunya to give us a sense of what are some of the preliminary steps that had to be taken. And we took those preliminary steps. Now, as we are living through the experience, we are having a clearer sense that, look, what we might need instead of the usual number of persons, number of fogging teams, is not necessarily 5 or 6, but 20. What we might need in terms of the amount of fogging machines that we have is not necessarily 4 or 5, but 30. And these are decisions that you would make to the extent that you could put yourself on a strong footing, and you put yourself on a strong footing by making sure that you are in tune with what is happening around you, by following the technical guidance and other guidance provided by CAFA and other agencies. And the ministry has been doing precisely that. And we are now rolling out our response in tandem with the best guidance that is available. So, you know, while at this juncture, having had the experience of the actual outbreak going on, we are taking certain steps to escalate our response. This is not a case where we have not been doing anything and we have not been proactive in our response at all. That's all I'd say.
JP Shumon, Asphalt News Network, OMG in the morning on Boom 169. And the Vincentian newspaper. I've got 3 quick questions, Mr. Minister. Is there any truth to the allegations that the government reduced resources to the vector control unit, having been forewarned of the pending outbreak? That's one.
Just take them one at a time.
No, you can go ahead.
You want that?
Is there any sort of statistical modeling being done to sort of predict, you know, the possible outcomes that from this particular outbreak? And 3, I noticed in your presentation you mentioned some of these approaches you're taking, but I don't know if it was an oversight or if, you know, it's not being addressed at all. But there have been deaths. Is there any sort of psychosocial response coming from the ministry to deal with particularly persons who are impacted by these deaths? With your response.
Yeah, I mean, I have heard the charge or the suggestion that resources to the vector control unit were reduced. That's absolutely not true. I mean, men must not live in a fanciful world and try to score political points on the basis of living in a fanciful world. We are dealing with a serious outbreak, and men who want to comment on matters of policy and matters of response must do so on the basis of a factual matrix. the very fact, quite apart from the fact that in the general scheme of budgetary considerations, there was no such reduction. The fact that we are coming here on top of what has already been provided with a proposal to add $1.6 million to the response, which would have an impact on the vector control department and public health in general, is a compelling, a convincing, and a complete response to that charge. You know, and this kind of thing is counterproductive, and it might divert our energies from maybe offering real and practical solutions and joining a whole of society approach to responding to this. And a whole of, I know that we are in the midst of a political season, but I'm not afraid to work with persons who are interested of any political persuasion to bring this outbreak of dengue fever under control in St. Vincent and the Grenadines. I think that is what is necessary. You know, imminent polls notwithstanding. I mean, statistical modeling, I don't know the extent of sophistication that you want to be a part of statistical modeling. I like to, from time to time, draw on my own statistical background, because I have a master's in statistics from Oxford. So that guides me on a personal level on looking at some of the ways in which this thing might go or grow. But what we do from the standpoint of the ministry is to just have a sense of the possible scenarios, because nothing could be written in stone, and it's still evolving. We need more information to have a better and a more complete sense. But we look at possible scenarios, and we look at what may be required in those scenarios. And we have ourselves on a footing that allows us to step up or moderate in particular ways our response based on what we see happening before our eyes, as guided by our response that is meant to be geared to particular scenarios. I think that the Chief Medical Officer might be able to make a comment on the support which is provided to persons who may have lost loved ones, but this is a standard part of the offerings of the Ministry of Health, Wellness and the Environment. And you know, in these circumstances where families are encountering difficulties, I'm sure that our resources in this respect will be made available to them.
Good afternoon, everybody. I'll just respond to the concern about the psychosocial support, and it's extremely important. We normally offer psychosocial support at the hospital, especially in terms of persons who have lost loved ones. We're also offering psychosocial support to our clinical caregivers. This has been an extremely challenging time for the healthcare workers also. And we express our great sympathy and concern to the ones who have lost persons have died, but also I'm very concerned, we're all very concerned about our healthcare workers. They have been giving up their best, they've been working long hours, and we all are saddened when we lose a patient. And so we have to also look out for healthcare workers, and there is a system in place where the psychosocial team will provide support to patients and caregivers.
Madam from the Agency for Public Information. Now I have two questions, and they're both. Yeah.
The following movements, man.
Right. So both of my questions are drawn from the experiences the Ministry of Health would have had in dealing with Zika and chikungunya. As we know, it was the same vector, the mosquito. The first question to you, Minister, I'm sure you would remember that several volunteers would have been taken up to be given in-depth training as it relates to mosquito destroy mosquito breeding sites and providing education to the public. Would these people be brought back as volunteers to this new set?
You want to ask another question too?
No, the other question is to the Chief Medical Officer.
The short answer to that question is yes. And we're happy that we took the initiative back then to train these persons. Not only did it prepare them to, over the years, do work in their own homes and their communities, even when not engaged by the Ministry of Health itself, but it allows us to draw on them as a resource during this particular time. Some of them might not be available because they may have migrated, they may have gotten employment, jobs elsewhere. Some of them might put the training that they had to use, perhaps just on a voluntary basis and so on, even while they do their other substantive job. But yes, we are planning to re-engage them, and we are also planning to take on additional persons who will be trained. It seems as if we have to have a standing army in this respect, so that we could deal with the vector-borne diseases whenever they arise.
Around the same time that we were combating Zika and chikungunya, I hope I remember the name of the person and the organization. I think Carissa Etienne from PACO. She made several presentations as it relates to the mosquito itself. And one of the disturbing things is its level of resilience to chemicals. So I'm wondering by chance if you remember that presentation and you're able to give some sort of scientific. Chief?
That's it, sorry, the Chief Environmental.
Yes. Basically to remind the public of how resilient
ask
this.
the question again.
Yes.
So that
Yes, basically remind the public how resilient this particular vector is to chemicals and how difficult it is to keep just fogging and fogging.
Okay, thanks a lot. Please be reminded that we are talking about the fastest growing vector disease in the world. It has increased 8-fold in the past 20 years. It also has been changing. So it is resistance to chemicals, and it is also getting smaller and bite often. So we are fighting against a disease that is basically going up.
Are there any other questions? Let's introduce yourself.
Good afternoon. Ashford Peters, Caribbean Independent Broadcasting Service and the newspaper. Now, we're just coming out of a dry season. During the dry season, you normally have like streams will dry up, except you'll have some pockets or some pools of water, which are breeding grounds for the mosquitoes. Now, what has been done, if anything, in light of that? In light of the fact that you've been warned of a pending outbreak, and these pockets of water, pools of water, have been there. Have you done anything at all?
I'm not really very clear. You see that we're coming out of a dry season and streams dried up.
Well, you have streams that some of them would go almost dry. You would have pools, pockets.
Oh, so in other words, they ain't really fully dried up. They partially dried up, and then they have pockets of water.
Yeah, pools of water. So the pools of water cannot really go down, cannot flow. So they are stagnant.
Well,
which would create sources, breeding ground.
Well, the thing is, I think that we are very far past anything called a dry season right now. You know, we may have had a dry season, but that dry season was ages ago, especially in light of the recent rain, so we might have to contend with.
But just prior to the recent rains, you know, we've had some very sunny seasons.
Right. But in any case, the answer to the question is that on an ongoing basis, we have been doing inspections, we have been trying to identify problematic areas, and when these problematic areas are found, we do something about it. More than that, we just want to encourage citizen responsibility. So if you know of any problematic river or stream that has dried up and has left puddles of water, bring this to the attention of the public health officials, and they will do something about it.
But Minister, right in your own constituency, you have had situations right there.
Well, I suppose it happens everywhere.
You know, but I'm just asking what has been done.
And I've answered that we have been doing ongoing assessment and taking action as required. Ongoing assessment and taking action as required. And areas in that constituency and other areas have been addressed.
Secondly, would you say, are we at a critical stage of the dengue outbreak? If not, how do you classify it? And what will be a critical stage? What would be considered a critical stage?
Well, I'm not sure how you're using critical. If you mean in terms of are we at the point where we have the highest number of cases, or is it a case where the outbreak is going to go into decline? I'm not sure how you use it.
Okay, on a scale of 1 to 10, how concerned are you or your government of about this outbreak as it is right now? We have 6 persons dead. We have over 400 persons affected.
Well, some questions are not best answered on a scale of 1 to 10. But I just want to say that the government is treating this matter with all the seriousness it deserves, and we intend to continue to do so for as long as necessary.
So you can say what will be the critical stage?
Well, I think, as I say, we are monitoring the trajectory of the outbreak, and hopefully it could be, we could see a reduction in the number of cases very soon.
Mr. Minister, does the ministry now subscribe to the point that people cannot be allowed to police themselves in certain situations?
If the government in general subscribe to the idea that people could police themselves, then we wouldn't have a police force. You know that, so I think
Basically, one of the ministry's biggest calls was on persons to, come forward and help to do something about it, but that don't seem to be working.
Yeah, I understand what you're saying.
It can even be seen in this week itself with COVID-19, where we had 3 persons taken to court for breaking the protocols.
Yeah, and I know that you are asking a very pertinent question, but I wanted to sort of put it in the general sense that within our society, we acknowledge as a principle that there is the need for agencies and organizations that are responsible for enforcement and regulation, and making sure that there is compliance with certain requirements.
But that's what I was trying to get at, really, because in the last press conference I spoke about the vector control unit officers walking around regularly in every area. So I was wondering if we would see that come back.
Well, there's certainly going to be a lot of activity, and I want us to make a distinction between the insect vector control workers and the general environmental health officers. I think that the inspections to which you're referring used to be done by environmental health officers, as distinct from insect vector control workers. And it is necessary in some cases for there to be an increase in the number of patrols. We are going to see heightened activity under this project, and I'm sure that there's going to be a new normal in terms of the frequency with which visits are made and reports are processed on matters to do with their portfolio.
If I may direct a quick follow, in your breakdown, we did not particularly specify the third component in terms of value, how much the education component will cost, and I'm also curious as to where the source of funding for the project overall, the 1.6 million it was, is coming from.
Was the first part?
You attempted to break down each component of the plan, part 1, part 2 in terms of value. One part was about 400K, but I didn't get the third part, how much that was.
Well, I was leaving you to do a little bit of mathematics. Because we announced the overall plan at 1.6 million, and then we said 1 million for the...
Under 1 million is what you said at first.
Okay.
So it wasn't definitive. So
I know.
I could read in mathematics,
I know. But we have $1 million for the first component, just under $1 million. We have $400,000, just under $400,000 for the component dealing with the clearing of drains and so on. And we have just over $200,000 for the engagement of the vector control assistance, and also for the production and dissemination of communication material, essentially. And the funding is basically going to be provided by the central government, and I'm sure that we will have partner agencies and organizations taking particular components of it as we go along the way.
Good afternoon, Kenton Chancellor for Witnesses and the Caribbean Media Corporation. Minister, can you please tell us what are the strategic indicators to be measured for this project to be deemed a success, and what benchmarks have your ministry agreed to?
Well, I think that on the most fundamental level, a strategic indicator is the mosquito indices, and which is a measure of the population of mosquitoes in the various communities, because the less mosquitoes you have, the less dengue you will definitely have. So that is the fundamental strategic indicator.
Okay, you spoke about the indices. I understand that the indices reflected in the monitoring and evaluation report.
Which one?
The mosquito index.
Is reflected, sorry?
In the monitoring and evaluation report, is that correct?
Well, I'm not sure about the specific report you're talking about, but there has been a report generated by the Public Health Department on mosquito indices in different parts of the country.
And generally, that report is generated every year? Is that the case?
They do it on an ongoing basis.
But you don't know the frequency with which it's done?
Well, there is no set frequency as far as I'm aware, but the Chief Environmental Health Officer,
Monthly.
they do it monthly.
Okay. All right, so I want to follow up on my colleague's question, Life's question, about the perception that the ministry was reactionary. For instance, we had schools opening. We heard in June or July that there was dengue about, but it was only 2 weeks ago that the Ministry of Health suggested, as far as we know, to the Ministry of Education that students be allowed to wear short clothing. It was only then, as far as I know,
that
long clothing to protect against mosquito bites. It was only then, as far as I know, that the public was told what medication to use or to not use, and importantly to not use in response to dengue fever. I mean, in light of this, how do you justify this response, that your position that your ministry was not reactionary?
Well, just to say that schools barely opened more than 2 weeks ago.
And that's the problem.
To start. So, I mean, the issuance of guidance on the possible use of long clothing actually almost coincided with the opening of school. You know.
School opened 4 weeks ago. Next week will be 4 weeks since school reopened.
So, if the information was provided 2 weeks ago, then it would have been close to, well, I'm not sure that it was 4 weeks ago that schools opened. I think it was the 7th of September. There was fogging of the schools before the commencement of the school term. And on top of that, there was the further information about the possibility of using long sleeve clothing for an additional layer or measure of protection.
But the anecdotal evidence suggests that most children who caught dengue caught it in school.
I'm not sure if there's any anecdotal evidence suggesting that, Kenton. I'm not sure about that at all.
Okay, I want to move on. Are you satisfied, Mr. Minister, with the response of your ministry to this outbreak of dengue? Are you satisfied that your ministry did everything to, I'm not sure if it could have been prevented, but to mitigate against the current status of the disease in the country?
Well, Kenton, I want to simply say I'm never satisfied. I'm always striving for a better response, to do better and to do more in all situations, and that is also true in this way. In this, what I could say in response to this outbreak, but what I could say is that we have been putting our best foot forward, and we would continue to do that going into the upcoming period.
Therefore, what do you think could have been done differently or better?
Well, that's something that we might have to have a discussion and a review as we review the ongoing outbreak. But what I could say is that I believe that everybody involved, on the basis of all the information available, has been doing their best to protect the health of
So no review has been done so far?
Well, we are in the process. Just like we are in the process of dealing with the coronavirus outbreak, there has to be an after-action review. We review our activities on a daily basis. But in terms of an after-action review, you're going to do that not on the spur of the moment or on the cuff, but in a reflective period of time.
And my final question to you, Mr. Minister, how do you respond to the view that you were so focused on being elected to Parliament in the upcoming elections that you lost focus of your work as a minister in limiting the impact of this outbreak?
Well, I respond by the facts. First of all, me being elected to Parliament me going to Parliament as an elected on the basis of results from upcoming elections depends to some extent on how well I do as the Minister of Health. So the two things are not divorced at all. I do my work in the Ministry of Health, and I do my work in the constituency of East Kingston, where I believe we will bring off a historic victory in these upcoming elections. So they're not divorced at all. I don't know if there are any other questions.
Any further questions? Okay, so we wish to bring this conference to a close, and I really would like to thank all of you for responding and responding so well at our very prompt request for you. I really do thank you as well for your questions, and I also would ask all of us, including you, the members of the media, remember again that we all have a shared responsibility. I mean, a lot of you would have kids, a lot of us have families, so we are all in this thing together. So thanks again, and I am very confident that we will see this through. Thank you.